In our spotlight tonight, the measles outbreak in South Carolina is growing. Health officials warn at least 124 cases have been reported since last Friday, and at least 443 cases overall since the outbreak began. They also say the majority of cases are in Spartanburg County in the northwestern part of the state. Doctors say measles is extremely contagious and that it spreads easily through the air. The CDC says anyone who is not protected against measles is at risk. So for more on this, I want to bring in ABC News medical correspondent Dr. Darien Sutton. And Doc, okay, so what is the latest on this outbreak in South Carolina and what prompted it?
Well, Alex, I want to start with the number 21 days. That's the amount of time that a child who's unvaccinated is required to quarantine if they're exposed to measles. And the reason why is because measles is so contagious that if you're unvaccinated, you have a 90% chance of getting it. And in some of these towns, we see significantly low vaccination rates, and we need at least 95% within the population and the community to create that herd immunity to prevent these outbreaks. But in Spartanburg, South Carolina, some of these schools, Alex, the vaccination rate drops as low as 20%. So the latest is that these numbers are increasing. They're continuing to increase as public health officials try their hardest to get a strong grip on this outbreak.
Well, and Doc, I mean, we've already seen this spread to other states like Georgia, Oregon, and Virginia, but I'm curious, for parents with infants that are too young to receive a measles vaccine, how can they protect their babies from exposure?
Well, the first dose of a vaccine is typically given around 1 year of age. This is the MMR vaccine, and that second dose is typically given around the age of kindergarten. Now, you're right. There are many parents that are rightfully concerned, given the increased risk and the rise in the rate of these cases. Important to note here, that one dose still provides good protection, about 93%. For parents who might be in a highly exposed area or traveling to an area that has a high rate of measles, you can talk to your provider about possibly getting that second dose earlier. You can get it as early as 28 days later. And also for parents to understand how to risk mitigate or reduce your risk. You want to pay attention to avoid crowded areas. You want to make sure to understand the symptoms of measles, which can include but aren't limited to the rash that we've all seen, but also cough, conjunctivitis or red eyes, and a high fever. And talking to your friends and family about getting vaccinated, as we know that that's the strongest way to protect against these outbreaks.
Yeah, well, and so something else that we're tracking, today President Trump signed the Whole Milk for Healthy Kids Act into law, putting whole milk back in school cafeterias across the country. Let's take a listen to what the president said about it earlier.
So today I'm delighted to sign the Whole Milk for Healthy Kids Act into law, which is a very important thing for our farmers, and I think maybe more important for our people, the people that drink milk. This is the first bill signing of the new year, and it will ensure that millions of school-aged children have access to high-quality milk as we make America healthy again.
So what do studies actually say about the nutritional value of whole milk?
Well, whole milk can be a good thing. You know, it's got some good components in it. It's got vitamin A, vitamin D, and some healthy fats that can help, especially with brain development. But it's so important to understand that of all the options of different types of milk, whole milk has the highest rate of saturated fat. And with nearly 1 in 5 children living with obesity, nearly 10% having high cholesterol in the United States, and nearly 1 in 3 living with prediabetes, it is so important to understand that the choices that you make at the supermarket can have direct implications on your child's health. So again, it's not about choosing one thing versus the other or choosing the right versus the bad, but it's about choosing the best product that can best suit your child's needs and help them to grow healthy, stay full, and become a healthy adult with decreasing the risk, while decreasing the risk of these other conditions that we're still trying hard to work on within the United States.
Dr. Darien Sutton, thank you so much.